Let's go ahead and get going. I think we've got 14, so I guess we're real close. I think we expected one more. We'll let them join as they come in. So, folks, first of all, welcome to the Innovations in Hearing Technology, hosted by Dr. Sophia Escobar. She's with Florida E.N.T and Allergy. Just a little bit about Dr. Escobar. She holds a Doctor of Audiology degree from the University of Florida. She obtained her undergraduate degree in Communication Sciences from the University of South Florida.
South Florida, yes.
Not South Carolina, South Florida. She's a fellow of the American Academy of Audiology and holds her certificate of clinical competence from the American Speech, Language, and Hearing Association. In 2012, she was awarded Best of 2012 Hearing Healthcare Professionals. Her special interests include vestibular testing, treatment, hearing aid prescriptions, and follow-up, including community outreach. You are in very good hands today, folks, with Dr. Escobar. We feel very fortunate to have her as part of the Earlens family. Just a couple housekeeping notes. You have the ability to send me a question. I am Matt Cavanaugh with Earlens. You can send me a chat, which will be personal. I will respond to you. Any questions you may have, and at the end there will be a phone number, email address, and a way to communicate with Dr. Escobar to set up a personal demo with her next week. So with that, I will turn it over to Dr. Escobar.
Well, good afternoon. Thank you so much, Matt. We really appreciate having this opportunity to work with Earlens, so thank you for doing that. And for everyone who's joining us today, I really appreciate you taking time out of your Friday to come and listen to boring old me. So thank you. I really wish I could see all of you and interact with you. And I want you to know that this presentation is going to be as much of an interaction as we possibly can. If you have any questions, please just stop me, send the chat to Matt like he was mentioning, and we'll be so happy to answer those questions. Okay. So our first slide is me. That's not, nobody likes to see themselves, so we'll just move on. So when I was getting ready to do this presentation, I thought, some of these patients I've had the opportunity to meet, some of them I haven't. So I'd really like to just kind of introduce myself first so that you can kind of get to know me and my family and such. So one of the biggest things growing up is that my father, which you can see in that picture down below on the upper right, has a hearing loss, and he's had a hearing loss since I was born. He's worn hearing aids since he was a teenager. And as he was growing and becoming an adult, the hearing loss progressed. We don't know where it came from. We don't know why. But by the time he was in his early 40s, he had a significant hearing loss that hearing aids just really weren't helping anymore. And so I'm so grateful to say that he did get a cochlear implant and now is thriving, can hear my children, which you can see there. That's my brother next to him and my mom, and I'm the one in the corner. And so, for me, hearing aids have always been kind of a part of my life, and the need for amplification and understanding individuals who have hearing loss has been very important to me. And as I was growing up, I really saw the challenges that he would go through when trying to communicate with other people. And so in college, I saw the quote, "You must be the change you want to see in the world." And it just kind of spoke to me, it resonated. And what I took from that was, well, okay, what can I do to kind of right this wrong or help people who are in my father's situation to do better and experience more? And so that's what led me to become an audiologist. Or as my daughter says, well, she's 6 now, so she doesn't say it anymore, but when she was about 4, she would say an audiologist, which I think is adorable. But as an audiologist, I'm able to fulfill my goal of making a difference in people's lives every day, whether it be with a cochlear implant or a hearing aid or Baha or now Earlens. I can see the changes that happen right in front of me, and it's just so fulfilling. It's amazing to have that patient start to cry about how much more they can hear, and then you do the same thing because they're experiencing something they never have. So grateful to do what I do. So that's a little about me. And my poor husband didn't make it into this picture. This was actually taken when my brother was going to go on leave with the Navy. He went to Bahrain and he's recently come back, so we're so grateful to have him home. All right, so a little about my place of employment. So I work at Florida E.N.T and Allergy, and many of you are our patients, so thank you. As you know, we are a very large group. We have 13 locations around the Tampa Bay and Pinellas County areas. These are our audiologists in the lower left-hand corner here, and we've actually added 2 new faces that you'll be seeing in the Brandon and Mid-Tampa offices if you come to those areas. So with FENTA, one of the things that we really value is continuing education. And when there's something else available to our patients, we want to investigate it, we want to learn about it, and we want to know if this is going to be something that is going to benefit our patients. And when we looked into Earlens, we thought, yes, this is an answer to those patients who maybe feel like hearing aids aren't addressing their needs. Maybe, they've tried them before or they're wearing them now, and it's just not enough. Okay, so I'm excited to talk to you some more about that. But this is our group. And again, 13 locations. So, if you relocate or anything like that, there's multiple other locations that we can see you at. We all share our files. So everything can be transmitted between the different locations that you go to really provide that comprehensive care. So in today's meeting, I've kind of led into what we're going to talk about. We're going to talk about hearing loss in general. We'll talk about some research studies. We'll talk about different options that are available to you for better hearing, or maybe your loved one if you're listening in for someone else. And of course, the new standard in hearing technology. So hearing loss. Hearing loss is really a challenging thing. It's someone that's affecting over 48 million Americans, and truly not enough people do something about it. In the past, I really think it was a stigma to wear a hearing aid and admit that maybe you don't hear as well as you do. But if you really think about it at this point, there's so much technology. People are wearing, Bluetooth devices and everything else, these AirPods and so forth. So, there's something in everyone's ear and nobody thinks twice about it. Hearing aids really should be the same way for you, because these devices now have the capability to be rechargeable. They have the capability to stream audio from your phone. So there's a lot more that it can do. But we have to remember that really by the age of 65, 1 in 3 have some form of hearing loss. We actually start to lose our hearing around age 50. So at the very least, it's really important for you to get a baseline audio and tell your loved ones to get a baseline audio, even if you don't think there's something wrong, because I can't tell you how many times I've had patients come in and say, gosh, how long have I had this hearing loss? And I don't have an answer. If we don't have a record of what your hearing has been like through the years from tests, then I really can't tell you, is this a sudden hearing loss? It's something that's been progressive, so we really encourage patients age 50 and up, let's start to test your hearing. Let's see just where you're at. It doesn't mean that you're going to land into a hearing aid like a lot of people think. It just means that we're going to have some baseline testing, like the testing you do for your eyes or the checkups you do with your teeth, like anything else. It's just another important sense that we need to measure. So again, the 3rd most common health problem in the US. So approximately 15% of adults over age 18 have some trouble hearing. And some of this is happening due to headphones like these. I know all of you have seen children or grandchildren who are constantly wearing headphones, constantly on tablets or on their phones, and exposing yourself to loud sounds or constant sounds over long periods of time can cause hearing loss. So it really is important, again, to get a baseline of where you are and protect your hearing by not playing things too loud over these types of devices. It's more common for men to have hearing loss, but some studies suggest that maybe this is due to the history of men sometimes having more noisier employment than women. So I'm interested to see how that changes as time goes on. With adults age 70 and older who have hearing loss and could benefit from hearing aids, only 1 in 3 actually ever use them. I want to share this with you. I had a patient come in today, young guy, who finally tried some hearing aids. He's had a severe hearing loss for a number of years, and he told me, you know, everything everyone said I would hate about hearing aids, I'm not experiencing. And that was just so refreshing. You know, he loves them. So please don't go, you know, based on what your friends say about their experiences with amplification. It really boils down to you and what your experience is with it. Your temperament, your hearing loss, the device you try, the provider you work with are all going to have a major impact on how much of a benefit you experience and how you feel about the hearing aids. So make sure you form your own opinion. So how do we hear? Well, hearing is a process, and I kind of break it down into 2 parts. So the first part is sound actually traveling into the ear, like you're seeing on my screen here, where the sound then goes up against the eardrum, vibrates the eardrum, sends the sound, or the bones of the ear move, and then they push in. You see where it says stapes there. I wish I could point for you. Oh, actually I can. Can you see that maybe? So with that, that is going ahead and pulsing up against the hearing organ, which is called the cochlea. In there, there's fluid. And as that fluid is moving through, it's changing the sound and amplifying the sound and sending it through the auditory nerve to the brain. That's the first part. From there, the second part is where the brain has to take that message that the ear has sent it and now decode that message. So when you come in to see us and we're testing your hearing, and actually let me see if my next couple slides will get there, but you'll see an audiogram. We're looking at the softest sound you can hear, and then also how well you're understanding the sentences or the final word of the sentence that we're asking. And when we're doing that, what we're trying to do is decode or understand how well you are decoding speech. And that tells me what we should expect with a hearing aid. So remember I was talking about fluid inside the cochlea? Well, in there, there's little hair cells. And the job of those hair cells is, again, to amplify the sound, okay? If those hair cells are damaged, which you can see in the second and third boxes there, they don't have the capability of amplifying sound enough to send it to the brain. And that's where hearing loss really starts. Part of the test that we do is called OAEs, or otoacoustic emissions. And with that, we're looking to see how the hair cells are functioning. So we can give you some input on that when you come in for your baseline hearing test. So here's the audiogram I was referring to. What you will see on the left-hand side here is soft sounds to loud sounds. And then across the bottom, you have low frequencies to high frequencies. So these are the ranges of speech. In the low frequencies here, we'll have more of the vowels of speech. In the high frequencies, we're going to have more consonants of speech. As we age, typically what we see is that the high frequencies start to diminish. And that's kind of what you're seeing in my picture here. The black line is suggesting someone who is younger, whereas the red line is suggesting someone who is older. But please know, just because these are what we see on, this is what we see on average, doesn't necessarily apply to you. I've seen patients who are in their 70s with great hearing, no hearing loss at all. And then I've seen patients, you know, in their 30s who have hearing like you're seeing on that red line. So you have to keep in mind that everyone's different, and these are just norms that we see, but we need to know what's happening with you specifically. So when we have a hearing loss like this, where you have a greatest amount of loss in the high frequencies, what patients tend to experience is difficulty understanding in noise, difficulty with understanding the television, and they'll say, gosh, you know, I hear people talking, but it sounds like they're mumbling, or I hear people talking and they're just not clear. That is a high frequency hearing loss. As that entire line starts to kind of flatten and go lower towards the bottom of the graph, that's when patients will say, I just don't hear people. I just don't understand people. And basically what's happening is now the vowels are being reduced as well. So everything in the tones of sound and speech are being missed. Okay. Any questions about that, Matt? Anyone asking?
The only question we had is, I'm glad you said that, is the hair cells in the cochlea, will they grow back or no?
Oh, no. So there's a lot of research, especially through the VA, trying to see if there's a way to regenerate hair cells. And I'll see a lot of articles that talk about an effort to do this in mice, and sometimes they're seeing it. But to my understanding, there's nothing along the lines of human trials at this point. Still just something we're doing to Mickey. Good
One
question.
more question just came in. I have hearing loss. Will it continue to get worse if I don't do anything about it?
Oh, great question. So it really depends on you, and we'd want to talk about your history. But I will say that it's not unusual for most of us to lose hearing as we age. So that's something that we expect to progress, but hopefully very slowly over time. For some people, that progression will happen more quickly. And so what we have noticed is that individuals who wear hearing aids are going to do better with them in the long run. The reason why is because the brain is used to receiving that good speech and language information. There's a lot of research out of Johns Hopkins that's talking about hearing loss and cognition. So as we age, our cognition is declining anyway. But when we have hearing loss, and even a mild hearing loss, the rate of that cognitive decline actually speeds up. And so in the original study that Dr. Lin had done, they were looking at individuals who had hearing loss, who wore hearing aids, and individuals who had hearing loss who did not. And when they did cognitive function testing, they found that the individuals who wore the hearing aids were better off in the long run than the individuals who didn't. So I think there's a lot of comorbidities and, things that go along with this. I'm not saying by any means that, wear hearing aids and your cognition won't decline. No. But I think you're giving yourself a fighting chance to really use that good speech and language information at a level that the brain can effectively compute it, and that you'll do better in the long run. So any other questions before we continue? That was a good one.
That's it for now. Thank you.
Okay, so, well, we've kind of already touched on this, right? So we're talking about the implications of hearing loss and what happens when we don't address hearing loss. And, when you come into our office, you'll probably see a poster that talks about brain hearing. And what we realize is that, again, hearing is broken into two parts. Your ears, where they go ahead and amplify the sound and send it to the brain, and then the brain actually decoding that sound. And that's where I think a lot of misconceptions about hearing devices and amplification comes from. The individuals who struggle with any kind of amplification are generally the individuals who have more decline in their word understanding. Where the brain is not effectively decoding it. So even though I use a device to make it louder, the brain still goes, I don't know what to do with this. And so patients say, yeah, everything's louder, but it's not clear. Yeah, absolutely. I can't unfortunately improve how your brain is interpreting the sound, but I can clean up that signal, make it as best as possible, amplify it as much as your hearing loss needs, and then, send it on to the brain with the hopes that we're getting a good outcome. So that's kind of what we mean by brain hearing. So this was the study that I was talking about at the Johns Hopkins Hospital. And they found that hearing loss is linked to a 30–40% greater risk of cognitive decline. And so it really, the decrease in cognition can be connected or correlated, I should say, with the degree of hearing loss that you have. So with a mild hearing loss, as you're seeing here, you have double the risk of developing dementia, whereas with a severe loss, you are 5 times more likely to develop dementia. So when we talk about risks like that, it only makes sense to feed your brain that good speech and language, just, wear the amplification and do what you can to try to improve those outcomes. So hearing loss is the one modifiable risk factor for dementia. And so again, here with another research study, they're showing that when these hearing aid wearers were tested, we could see that their cognitive ability was similar to that of normal hearing participants. So, you know, study after study is showing how these two things are correlated, not a one-to-one, but correlated strongly. Okay. Oh, and then I'm sorry, I missed one item here. So at our practice here at Florida E.N.T and Allergy, sometimes in some of the offices, you may see some physical therapy happening. Well, that's because research has shown that individuals who have untreated hearing loss are actually 3 times more likely to experience trips and falls. So the group that works with us is called Physical, and this is our solution for patients who are dizzy or have issues with their balance. And I'll hear them outside my door every day talking to their patients saying, are you wearing your hearing aids? Are you wearing your cochlear implant? And because they're trying to, do treatment and they're noticing that the patient isn't responding. And then they will tell me when the patients do wear their devices, how much better the session goes, how much more they feel in balance. And I've heard patients themselves say to their therapist, I'm wearing my hearing aids today, I feel so much more balanced, or they were out for repair, so I didn't have them. And I noticed the difference, So hearing those personal accounts really, really make a difference. All right, so we've talked kind of generally about some treatment options and about technology. So let's kind of dive into what we have to offer. So when it comes to hearing loss, we of course want to do a one-on-one consultation with that individual to really talk about their specific hearing loss and what solution fits best for them. Some of the things we might talk about are non-surgical solutions, like you're seeing on the left here, which are talking about hearing aids traditionally, right? The in the ear or the behind the ear hearing aids. On the far right, you'll see surgical solutions where we talk about implants, middle ear implants, a bone anchored hearing aid, a cochlear implant. So those are going to be more for the individuals who don't do well with hearing aids, right? And generally for those individuals, they either have a single-sided deafness or have significant hearing loss in both ears. Again, this is an example of what my own father has. And on the other side, he wears a hearing aid, right? So sometimes it's a hybrid solution doing 2 things. Well, what I'm so excited to talk to you more about today is Earlens, which now is another solution that kind of fits in the middle. Not quite a hearing aid, definitely not a surgical implant or anything in that direction, right? It's called a non-surgical direct drive solution. And what you're seeing on this picture here is the processor, which looks kind of like a traditional hearing aid. And then that piece right below what we call the ear mold is called a lens. And that is a custom device that is made, or a custom piece that is made specifically for you. So let's talk some more about that. So as you know, with conventional hearing aids, what's happening is where the hearing aid itself, the microphones are taking in the sound, processing it, cleaning it up, and amplifying it through a speaker to send a stronger sound wave to the eardrum to be processed. And you've probably heard your audiologist say to you, if you wear hearing aids, well, make sure your hearing aids are all the way in, because if you don't have them all the way in, you're not getting the maximum amplification, or you're going to get some feedback, or the sound quality just won't be as good. And I'll have patients say, gosh, when I press my hearing aids in, I feel like I hear so much better. Well, what you're doing is making that sound, which is being amplified, be louder because it is closer to the eardrum, and creating more pressure, okay? Well, the limitations of a traditional hearing aid are going to be that technology is good, but sometimes we get feedback, like we were just talking about, feedback being the whistling, right? Sometimes patients say, it just sounds tinny, it doesn't sound natural. Or maybe they're saying, gosh, I hear great one-on-one, but when I get into noise, it just doesn't sound that clear anymore. And then I've never had a patient come to me and say this, but I've said it to a patient, is limited bandwidth. So they'll tell me, gosh, I feel like my grandchild who has a really high-pitched voice, I'm having some difficulty understanding them, right? And that has to do with the bandwidth. So we have a solution for that.
One question, if I could, before.
Absolutely.
Sorry about that. We just had a question come in. I think it was from one of your previous slides when you talked about the different options that you sold. One more back.
This
there.
one?
Yep. Somebody asked if you guys do the surgery, your group, for the cochlear implants.
Great question. Yes, we do. We have a physician that works in our South Tampa office and in our Countryside and Largo location. His name is Dr. Malone. And he does do bone anchored hearing aids, and he does cochlear implants as well. So if you think you might be a candidate for that, I would love to hook you up with Dr. Shashadi or Dr. Fodor. Those are our two audiologists who actually do the testing for cochlear implants or BAHAs, bone anchored hearing aids. And we can evaluate and determine if you really are a great candidate. From there, we can determine whether your insurance will pay anything towards it and so forth. So yes, please message Matt or email me, and we'll get you along the path that you need to be. Good question.
Okay, thank you.
All right, so the Earlens solution. And Matt, if I miss one of the animations on here, help me out with that, forgive me. But this is the lens.
There should be a little down there, or a little thing. If you scroll down, you should be able to roll over it.
I see it. Yeah, my little box was covering it. Okay, so this is the lens itself. And so this is kind of your 3D version of it, but let me make it stop right where I can. Aha. Whoop, pause. Well, let's go one more time here. There we go. Okay, so I don't know if you can see the little pointer finger. Can you see that?
Yes.
Okay, perfect. Thank you. So this is actually the portion that is pushing the eardrum, or pushing the umbo, if you will. So it moves the eardrum in a more forceful manner, nothing painful, but a little more forceful to allow the sound to be amplified. So this is that lens I was telling you about. And then the portion over here is actually going to receive the signal of how hard to push from the ear mold that I'll be showing you here in just a moment. This lens is pretty cool because it's actually an impression of your eardrum that is taken. We want to know the shape of the ear canal all around the eardrum and how close to the eardrum we can get to be able to create some of that pressure to allow you to have more natural, better hearing. So this is a really cool portion of the device. The Earlens lens itself is going to be, the impression is going to be taken by one of our physicians. And this is actually a good time for me to mention that this device is not something you're going to find anywhere else. And what I mean by that is that one of the requirements for Earlens is that you have a physician and audiologist partnership to be able to provide this product to the patient. So at FENTA, we are just so experienced in this. You've probably seen us in the hallways talking to each other about our patients and making sure that we're providing the very best care and solution to them. So that close relationship between your physician and your audiologist is what makes our patients successful. So the physicians get to join in on this particular treatment by taking the impression of the eardrum for us, and then actually placing that lens onto the eardrum when it's time to do your programming. The audiologist will still do all of the programming for you, troubleshooting, and check on the placement of the ear lens as we're going through your treatment. So when we look at the ear here, this is again that kind of schematic so you can see the internal portion and the external. And what they're showing you is at the top, you still have a processor behind your ear like we saw in the other photo. You have a thin wire going down into the ear, and then you have an ear mold. They're calling it an ear tip because it's not a traditional mold where sound is being, pushed through, but rather this is the item that is communicating with the lens itself to allow it to know how much pressure to provide. Okay. So it looks the same from the outside, but you've got something special on the inside. So why Earlens? Well, we do have hearing aids for our patients, and we know that normal hearing goes to about 20,000 hertz, right? So you can see that kind of rainbow graph here showing that. And with a hearing aid, we know that we can reach about, 6,000 hertz. I'd say that should be pushed a little bit more to the right, but about that range, right? And this is where a patient says, well, things sound kind of tinny. And what we're trying to do is push those higher frequencies down to another frequency where you can hear things a little better. And so it might sometimes have a little bit of an artificial sound. So Earlens is nice because it actually gives you a more natural, wider bandwidth to allow sounds to be not tinny, but clear. So the Earlens system, because again, we're not amplifying the sound through the conventional pathway of just making things louder and pushing that sound pressure into the eardrum, rather by moving the eardrum itself based on the amount of pressure it should be receiving to allow a higher bandwidth, gives patients this sensation of feeling like hearing is more natural. They don't report to us that it sounds robotic. I think that's the best way a patient's described hearing aids to me before. So it's really nice to see that we have an option for patients who go, nope, a conventional hearing aid just doesn't work for me. It's not satisfying. So, and of course, by reaching those higher bandwidths, it's that superior natural sound quality. I'm going to throw that in there because just the crispness of it is really what makes the difference. And of course, you're getting twice the frequency spectrum of sound. And the good news here is virtually no feedback. So one thing I will say, let me move this out of the way again, is that when patients have a higher frequency hearing loss and we're trying to amplify that sound, feedback is the worst thing that happens to us. And it's just so amazing that with Earlens, we don't have that. And again, it's just because of the way the sound is being processed. Okay, so this is going back to our hearing test graph again. And what you can see is what we call the speech banana, which is kind of a silly name for it, but that's this curve that you're seeing here. Again, this graph is showing you that in the lower frequencies, we have more of the vowels of speech. In the higher frequencies, we have more of the consonants, whispers, leaves rustling, birds tweeting, right, versus something louder and more mid-frequency like a piano, or low frequency like a dog barking, right? Oops. And here, oops, oh my goodness, I'm clicking too many times. So here, what we can say is that with having that broader bandwidth, again, if you're looking at this graph, you're seeing here in this lower right-hand corner that we're going out to 10,000 hertz, you're getting that natural quality of sound. And also it helps you to understand better in those noisy environments because we're giving you those higher frequency consonants of speech. One thing I will say in doing some of these demos with patients when they're listening to a traditional hearing aid versus an Earlens is that they will say time and time again that music sounds so much better with the Earlens device than it does with hearing aids. And again, that wide frequency range absolutely is the reason why. Makes sense. So here are some examples of what patients have said. Earlens has changed my life dramatically. I go to social events more often now because I can follow conversations. The Earlens system has provided me with a level of hearing that is extremely natural. It reminds me of when I was a young man. I'm hearing things that I haven't heard in 30 years. I'm hearing the timbre in people's voices, the subtleties of conversations in the background, noise, natural sounds in our environment. The Earlens has changed my life. And that was actually one of our, a physician that has had an Earlens device. And I can hear the birds that I've never heard before. It's like experiencing more of the world, and it's very pleasurable and very empowering. This is the kind of stuff that I'm running into, when we're fitting these devices on people. Truly, when the tears come, I know that we're making an incredible difference, and I just couldn't be more satisfied. This is why, again, when services that are new, that are available, we want to explore them because we want to be on the cutting edge. We want to be able to provide an array of solutions because there's different patients with different needs. And if we have something to address every one of those patients, we're doing what we're supposed to be doing as a practice, but also as an audiologist. So I'm so grateful to hear these types of things.
Okay, got another question.
Yes.
So the question is, I struggle to understand people when they're speaking. I have to read their lips and try and piece the sentences together. With the masks that we have now with COVID, I can't read lips. Will this system help me understand what people are saying?
Oh, yes. So COVID has been a beast. Wearing masks has been a huge challenge, not just emotionally, but as far as communication goes as well. For people who have hearing loss, who maybe haven't done anything about the hearing loss before, um, this wearing of masks has really encouraged them to move forward. And I can say for those people that I've spoken to and fit, yes, they say they're hearing so much better. For anyone who maybe is using a hearing aid right now and feels that with masks they're struggling and they're not quite understanding, I encourage you to come in and see your audiologist, because there are adjustments we can try to make to the hearing aid to give you better understanding in those environments, because we understand that the voices are just more muffled now because of that. So there's some soft frequency stuff we can do. So please come see us. But if that's not enough, I really encourage you to come in for the demo of the Earlens so you can hear what I'm talking about. Matt, this is a time to mute your headphones for a minute. I'm going to tell them a secret. Honestly, when I first heard about Earlens, I'm like, all right, sounds cool, but let me see. Oh my gosh. When I listened to the comparator, which is something we can demo for you, that's when I was like, okay, this is something, we've got to do this. And I remember I came back from the training and I start talking to one of our physicians about it, and he's doing the same thing. He's like, nah, all right, knew something. And I'm like, no, you've got to hear it. And sure enough, when he did hear it, he was like, yeah, okay, I see what you're talking about. I've got a couple people in mind. And he started telling me about some patients that he thought would really benefit from it. And some of them have the opportunity to come in and demo already, and they hear it too. So it's one of those things you've got to listen to. And the great news is that, we have two, like Matt had mentioned earlier, we have two different demo days that we're going to do, August 31st and September 1st. In our Riverview office, and there's no charge to come in and listen to it. So I don't know why you wouldn't come in, listen, and tell us what you think, because truly that's what made the difference for me. So, Matt, you can turn your headphones back on now.
I did, and actually, it's interesting. That's what made the difference for me when I came on board. I listened to the demo, and that's what really sold me to come on board to really be a part of this very exciting new technology. So thank you. I have another question. Are they waterproof?
Are they waterproof? So hearing aids and Earlens are not waterproof, meaning that you can't go swimming with them, you can't get in the shower with them. You do need to take them off in those instances. The lens, which is a part that's going to stay in your ear consistently, is something that will be able to get wet. But you just want to make sure you're not, submerging and swimming laps without having something else in your ear too. Something else being like some swim plugs. And then there's some care and maintenance stuff that we can get into a little bit too, but it's pretty simple. You're just using some mineral oil on a daily basis just to keep the ear lens comfortable and up against the eardrum. So long story or short answer, no, you can't get them wet. More involved answer, but the Earlens can.
Okay,
Other questions?
Thank you. That's it for now.
Perfect. All right. So, so really what we're talking about here is something we've touched on already. What makes Earlens different? Well, this is premium care. This is something that you've never experienced before. You have a physician involved in your care. You have an audiologist involved in your care. You have custom technology that is made specifically for you. And even beyond that, you have a concierge, which, gosh, I wish I had for my other patients. We kind of do. We have our audiology assistants, and they're really good about being able to field things very quickly for you. But this concierge service is pretty fancy, I will say. So I'm really enjoying that level of care for our patients. So definitely a premium product. So regarding that concierge care, what you're experiencing is an individual that you can call who will give you personal attention and support in your hearing journey. They know where you were fit. They'll know all the good details about your particular device. And if you were in another state on vacation, or maybe you winter someplace else or summer someplace else, they can tell you exactly who is available in your area to service your product. So that makes things a little different from the hearing aids. Yes, you can go someplace else and receive care from another audiologist, but this concierge program is kind of carrying you through that. So when you get to that office, they're like, "Hello, Mr. Jones, we were expecting you." And they know all of your information. It's not kind of that difficult situation where we're going, "Okay, well, let me see if I can get your records. Let me call and see if you're under warranty." No, they know all of that already. So that personal attention really puts this particular product on another level. And then even after that, I don't have to go, "Oh, could you please send me the records on Mr. Jones and what you did?" No, the concierge sends it right to me. You don't even have to worry about doing that. So that level of care and support is just something, again, that I wish I had for all of my patients, but just doesn't exist. But Earlens provides. So if you're ready to try and you want to hear the difference, I definitely suggest that you schedule an Earlens consultations with us. Oh my goodness, Matt, we didn't change the name of the practice. Tisk tisk. That's okay. So see, there's other providers you can go to as well. But FENTA is the one you should come to. Yes. When you come in, what we will do is, of course, just demo the device to you, talk about your specific hearing test and your hearing loss. And then from there, if we decide, yes, this is something you want to try, something you're willing to move forward with, we will take impressions of your ears. Well, we'll make an appointment to take impressions of your ears with a physician. We will send those impressions out to be made and have your device sent to us. And usually that's about a week or, 2-week process, right, Matt?
Yes, 2 weeks.
Timelining correctly. So about 2 weeks. From there, you'll come in, you'll see the physician again. They will go ahead and place the lens for us, and then you can come on over to me. I'll place the external device and we'll start to do some programming and you get to hear right away. One thing I really do want to caveat about this is that the demo that you hear is good, but when you have the lens that is made specifically for you, and the device, the external device is programmed specifically for you, the sound is even better. So that, to me, is also very exciting and something that I can't wait to experience with many of you. The patients that we've had go through this program already are so pleased, and it's so exciting to hear them say those types of things like, "Wow, this sounds even better than the demo," and that it just is making such a difference. So then from there, you have a 45 to 60-day trial period. The reason why we kind of mix it up is because some patients are like, "No, I'm good to go" after 45 days. And they say, "I don't really need to see you anymore. Things are great. I'm happy. I'll see you at our 3-month check." And then other people are like, "Well, if we could just tweak the ear mold a little to make it fit a little more." Again, we're working with a custom product here. So they're pretty good about getting it right the first time, but sometimes there's something we want to tweak, So that's what that extended trial period is for. And the good news is that if you decide that Earlens is not for you, just like we do with our hearing aids, you're welcome to return them. And everything that you've paid can apply to a different device or a different solution for you, and we can talk about what those are. And if you decide that it's not for you at all, that's okay too. There's a minimal monetary amount that is kept to just cover the time and the shipping and so forth that we've done.
Okay.
All right.
Question. Yeah. I currently have a pair of Oticons that were significantly expensive. I answer the phone and watch TV with them. Can I do the same features? Can I do the same with yours? And what does that cost in terms of features?
All right, so with the Earlens system, what you can do is stream audio between your iPhone and the devices. They do not have an accessory called a TV device just yet, but what you can do with your iPhone is, how they have that mic system on there, a remote mic? what you can do is turn that on and then set that next to your speakers and stream the audio that way if need be. But most patients say that, they feel that they're hearing the television much better when they're wearing devices in general. When we talk about Oticon hearing aids, that's something that we work with as well. And we talk about them being, pricey or expensive. I want you to keep in mind that with any of these solutions, you want to understand that you have a warranty and a service plan wrapped into them. With the Earlens device, you're getting a 3-year manufacturer's warranty, loss and damage coverage, and 3 years of service from that Concierge program, and then also from us, Florida E.N.T and Allergy. So the cost of a product, whether it be a hearing aid or whether it be Earlens, is also including all of that service. And what you should know is that even with hearing aids, patients on average are using about $5,000 worth of service in a 3-year period. So you've got to keep that in mind when you're considering the cost of a product. It's not just the device, it's all of the personal care and warranty that goes into that as well.
Great. Next question. Is there a minimum age for Earlens?
Oh, Matt, I'm going to toss that one back to you. I will say, though, that as Florida E.N.T and Allergy, we only fit adults. We do not fit children at this time. But I don't know if, Matt, if you've worked with any pediatric groups.
We have not. It's 18 and above.
Okay.
I think our youngest patient right now that I know of is 26.
Yeah, and that makes sense because in just thinking about the auditory system, the ear canal, and so forth, as we grow, we want to keep in mind that children are still growing and sometimes exponentially over a period of months, right? So a lifetime ago, I worked in pediatrics, and when we would see our children, we would try to see them at least every 4 to 6 months to take impressions of their ears to make new ear molds because they would grow out of the ones they have. So I'm sure that with the Earlens device, we have to think about doing the same thing, and that can become quite costly. So it makes sense.
The next question, are there any issues with them on planes at high altitudes, on takeoff or landing with ears popping?
No, there should not be any issues. Matt, are you aware of any?
No, and that's one of the things about the motor and the springs that you touched on when you showed the Umbo platform. Basically, that will allow it's called Valsalvo, as you basically go up and down and you've got pressure changes. It allows the motor to move with the eardrum. So as it goes in and goes out, it will stick to it and it will not affect the eardrum or the product.
Mm-hmm. Yeah, and I should say too that patients report they don't even feel the lens once it's placed. So.
Correct. Another question, tinnitus. Will it help with my tinnitus?
Mm-hmm. Yes, so tinnitus is tough. There's many different causes for tinnitus. Stress level can be part of it. Hearing loss is one of the major causes for it, medications and so forth. So, when you're working with your provider, we really want to try to get to the bottom of what's causing your tinnitus or ringing in the ear. But what many patients will say is that when they're wearing amplification devices, they're getting better, they're getting less tinnitus and just better hearing overall. So the thought process behind that is that those frequency regions of the brain that are processing those high frequency sounds, because they're getting that better stimulation, we're not getting this spontaneous firing that is potentially causing the tinnitus. But again, everybody has different reasons for tinnitus and experience it differently. But yes, you may receive benefit from it. And again, the only way we know is by trying.
Great. Next question is the cost of the system, and does insurance pay for any of it?
Mm-hmm. So the cost of this particular system is going to be $12,000 for this set. Insurance may cover some things. There's not a lot of insurances that cover hearing aids, unfortunately, or hearing devices. So that's a case-by-case basis. We do have financing. We accept Care Credit, which gives you 12 months of interest-free financing. And again, it depends on whether you need one or two. The price for one is going to be a little less, right?
Okay, let's see. Again, I guess the question a little bit earlier was, when they place the lens, does the lens have to be placed surgically or is it done in the office?
It's done in the office by the physician. So this is a non-surgical solution. That's the important thing to remember. The physicians are involved. And again, that's, with the cost of the instrument, keep in mind, you're seeing a physician, you're seeing an audiologist, you have the concierge service, you're getting the 3 years of warranty, loss and damage, service, repair, so there is all of that bundled into the cost of the devices. You're not going to pay anything extra for these devices through your journey unless you were to completely lose the hearing aid. And then there's just a deductible to replace it.
Okay. Warranty. What is the warranty and what is covered?
Yep, so 3-year warranty, and the coverage is the lens, the external device, the mold, the entire system. It also provides the service and the care that you're going to receive from the physician and the audiologist. So when you come in, what you also want to keep in mind is that with this hearing device, just like with hearing aids, we want to see you at least every 3 to 4 months to, in this particular situation, check the placement of the lens, make sure that everything looks good there, make sure you're using your oil regularly, and then also check the external device. So all of that, again, all of that personalized care is included in your 3-year plan.
I think you had mentioned that there was going to be some numbers and emails on the slide on how to set up a demo. If you advance the slide a couple more, because right now we see schedule your personal demo, but there's no information on that. Oh, did we freeze?
Oh, there you are. Oh, lost you for a second. You there?
Yep, there we are.
Oh,
So you focus
okay.
on me.
Hello.
So if you advance it again, so you can see your numbers and your email there on the slide.
All right.
There we go.
Perfect. Thank you. So we have, of course, the Hillsborough County office, and then we have the Pinellas, but this will take you to our patient care center line. And if you put in extension 1325, you'll speak to my assistant directly, Alex. And then the easiest way to reach me is through my email, which is Escobar at Florida E.N.T and Allergy.
And I think there was some dates too.
Absolutely. So the dates again are going to be Monday, August 31st. We have appointments available in the afternoon, and then Tuesday, September 1st in the morning.
Another question just came in. How long are the devices made to last, even with great upkeep?
Well, a standard hearing aid is going to last you about 4 to 5 years. The Earlens device is going to potentially last you longer, which is something else to consider when we're looking at the price differences between the two. So I know, Matt, you've mentioned that there's individuals who have a lens and have had one for about 5 years, if I'm understanding correctly.
Almost 5, 4 and 3 quarters, yep.
Yep. Okay. So that's something that we don't expect to change too much, because that area right next to the eardrum is not something that should necessarily, stretch out or anything with time. So I think your impression is going to last you a lot longer. The external portion, which is the processor, again, is guaranteed for 3 years, and the manufacturer, and Matt, you can speak to this some more, but my understanding is that if there's firmware upgrades, we'll be given those and so forth.
Any firmware, software, hardware that is during that time period will be upgraded to the patient at no charge. Most of the firmware will be done wirelessly. At this point in time, they'd still come in and see an audiologist, and they would basically update the firmware for them. Down the road, that may be done over the cloud. Not just yet, but everything else that comes out, they will reap the benefits for the full 3-year warranty.
Perfect.
And that's all I have for questions right now.
Perfect. Well, again, thank you everyone for taking time out of your afternoon on a Friday, especially to listen to us talk about this great new product that we're so excited to offer. And I really hope you have either contacted Matt through the chat, or will email me or call us at the number to go ahead and come in for your demo on those 2 days, August 31st or September 1st. We're really excited to show you what we have to offer and get your feedback.
I want to take the opportunity again to thank Dr. Escobar. We failed to note this in the beginning. I think it's important to note that she is not a paid consultant for Earlens. She is a provider that has been on board with us now for about 4 or 5 months, just before COVID hit, actually. And she is basically doing this because of the success that she's seen with her patients and the excitement that she has seen. So we want to thank her for her time. We want to thank all of you people for your time to come out and spend some time with us on a Friday afternoon. You will be getting a call more than likely from the people that called you originally to set up the webinar. If you want to come in for a free demo, please feel free to do so. You've got the numbers on the screen there, as well as the email, and they can help you when they call you to thank you for your time and ask you any questions. So with that, I will say have a great weekend. Thank you, Dr. Escobar and FENTA for participating in this, and we will talk to everyone and see you hopefully very soon.
Thank you, Matt, and thanks for offering this product. It's great. Have a great weekend, everyone.
Bye, everybody.
Bye.